Hey everyone, welcome to today's Explainer. Today, we're diving straight into the blueprint of a brand new organization that's tackling a genuinely critical public health crisis across Africa. We're looking at an initiative designed to empower an entirely new generation from the ground up.
Here's our roadmap for this Explainer. We'll start with the youth health crisis, move into defining body and boundaries, break down their mission and core objectives, explore the programs driving real change, and finally, wrap up with a vision built on values.
All right, part one, the youth health crisis. To really get why this organization is so absolutely crucial, we first need to understand the systemic challenges stopping young people from getting safe, reliable health information.
Across a lot of African contexts, there's just this profound silence. Deeply ingrained cultural norms and social stigma often make it incredibly hard for young people to just ask basic questions about their own bodies. Throw strict gender norms and power imbalances into the mix, and open discussion is basically shut down. And what happens when you don't have accurate information? Well, it creates this massive vacuum. And unfortunately, that vacuum gets filled fast with misinformation and unsafe practices, literally stripping away the personal agency of these young folks.
The real-world impact of all this silence? It's honestly jarring. Let's look specifically at Kenya, where this organization is currently based. The national data is a massive wake-up call. Right now, about 23% of pregnancies there are unintended. To put that into perspective, we are talking about an estimated 500,000 adolescents, specifically aged 10 to 19, becoming pregnant every single year. 500,000 young lives completely altered annually just because of a gap in youth-friendly education.
And the reality gets even starker. Out of the 38,000 new HIV infections recorded every year in Kenya, young women between 15 and 24 make up nearly a quarter of them, 25%. These aren't just numbers on a page. They're a huge flashing warning sign pointing to the dangerous lack of supportive environments where youth can actually make informed, safe decisions.
Moving on to Section 2, defining body and boundaries. Let's see how this specific solution stepped up in 2025 to tackle these exact challenges head-on.
Enter Body and Boundaries Africa. Set up in 2025, this group was built specifically to create safe, inclusive spaces for youth, especially those right in that critical 15 to 35 age range. The whole idea is to get them accurate health info and build the confidence they need to actually use it. And hey, while they are starting out in Kenya, their game plan is totally designed to scale up and adapt across the entire African continent.
Now, what's really cool is how just looking at their name gives away their whole game plan. Take body. That part is all about body literacy, figuring out how your physical self works, navigating emotional changes, and really owning your sexual and reproductive health. Then you've got boundaries. This half is entirely about consent, respect, and personal agency. It's about having the guts to communicate your limits and handle relationships without any coercion. It's the whole shebang, physical knowledge mixed with emotional well-being.
Okay, part 3, mission and core objectives. We know who they are, so how exactly are they pulling this off?
Their big picture mission is totally straightforward: empower young people through education, advocacy, and community engagement. They are completely dedicated to making sure every single young person can easily access accurate info on their sexual and reproductive rights, while also learning how to uphold their own boundaries and build genuinely healthy relationships.
So how do you actually do that? You break that massive mission down into these 5 clear goals. First, increase knowledge of bodily autonomy. And second, actively promote the practice of consent. Notice those next 2 goals. They focus hard on making HIV and contraceptive info much more youth-friendly, while creating those safe dialogue spaces to finally crush that stigma we talked about earlier. And fifth, they aren't trying to do this solo. They're actively boosting the capacity of colleges and community partners to deliver this youth-centered education. It's a total team effort.
Which brings us to Section 4, programs driving real change. Taking high-level goals and turning them into grassroots action requires some super targeted initiatives.
Their first major program is called Consent and Condoms, and this one hits physical safety head-on. It's all about responsible decision-making, but with a massive emphasis on shared responsibility. The really crucial part here is how they explore the ways a lack of consent, or feeling pressured, directly spikes a young person's risk for infections and sexual violence. By actually teaching negotiation and safer sex, they're fighting directly against those scary statistics we looked at earlier.
Then we have their second core program, Healthy Heart, Healthy Boundaries. This one shifts gears over to emotional and social well-being, acting as their main engine for preventing gender-based violence, or GBV. It takes aim at harmful gender norms and power dynamics, and really importantly, it teaches youth how to spot the early warning signs of emotional abuse.
It's all about building fair, equitable relationships through boundary setting and mutual respect.
Finally, Section 5, a vision built on values. Whenever an organization handles stuff this sensitive, we have to look at the bedrock principles keeping their work on track. Everything they do is anchored by these 5 core values. They honor individual dignity through respect, and they celebrate diversity through inclusivity, making sure their resources are truly for everyone. They rely on the power of education, they approach every difficult conversation with total compassion and zero judgment, and they maintain strict integrity by only ever dealing in accurate, evidence-based facts.
All of this leads perfectly into their ultimate vision for the future. They want to see a world, specifically a future where young people across Africa are informed, confident, and empowered to make safe, respectful, and autonomous decisions about their bodies, relationships, and health. It's a vision of a continent where empowerment completely wipes out stigma and knowledge entirely replaces fear.
So I'm going to leave you with this to chew on. As Body and Boundaries Africa scales this adaptable blueprint, teaming up with universities and community groups all over, think about the ripple effect. When an entire generation finally understands their bodies and confidently owns their boundaries, how fundamentally will those empowered kids reshape the social and public health landscape of tomorrow? Thanks so much for joining me for this explainer, and as always, keep asking the big questions.